नमस्कार सबको। मैं डॉक्टर रिया आप सबका स्वागत कर रही हूँ आज के वेबिनार के लिए। अ, मैं पीडीएमडीएस की तरफ से आप सबका इस वेबिनार के लिए स्वागत करती हूँ। पीडीएमडीएस यानी पार्किंसंस डिजीज एंड मूवमेंट डिसऑर्डर सोसाइटी। सो आज का वेबिनार हमारा योगा के ऊपर है, जिसमें हमारी स्पीकर डॉक्टर राजवी मेहता है। ओके। हमारी फाउंडर डॉक्टर बीएस सिंगल है। हमारी सोसाइटी 2001 में हमने शुरू किया था, ये हमारा सोसाइटी डॉक्टर बीएस सिंगल के निर्देशन के अंदर हमने शुरू किया था ये सोसाइटी। हमारी सोसाइटी का उद्देश्य है कि हम पार्किंसंस के बारे में जानकारी बढ़ाए और पार्किंसंस में क्वालिटी ऑफ लाइफ ऑफ पीपल विद पार्किंसंस एंड उनके केयर गिवर बढ़ के लिए हम उनकी क्वालिटी ऑफ लाइफ बढ़ाए। ऑल्सो हम अवेयरनेस रेज करने का हमारा एक और उद्देश्य है। हमारे अ, हमारी सेशंस में हम फिजिकल एक्सरसाइजेस कराते हैं, पार्किंसंस के बारे में जानकारी देते हैं, कॉग्निटिव एक्सरसाइजेस कराते हैं, डांस एंड मूवमेंट कराते हैं, डाइट एंड न्यूट्रिशन के बारे में जानकारी देते हैं, आर्ट एक्टिविटीज कराते हैं, एक अलग अलग प्रकार की एक्सरसाइजेस कराते हैं। ऑल्सो हमारा एक हेल्दी एजिंग प्रोग्राम है, जो हम सीनियर सिटीजन्स ग्रुप एंड रेसिडेंशियल होम में सेवाएं देते हैं हमारी। करंटली हमारे 70 प्लस पार्किंसन सपोर्ट ग्रुप और 112 से ज्यादा हेल्दी एजिंग ग्रुप्स ऑल ओवर इंडिया चल रहे हैं। सो आज का ये जो हम वेबिनार कर रहे हैं, उसके लिए डिस्क्लेमर कि ये रिकॉर्ड हो रहा है, तो जो भी अनकंफर्टेबल है उनका वीडियो दिखाने के लिए वो अपने वीडियोस को ऑफ कर सकते हैं। पार्किंसंस के बारे में थोड़ी और जानकारी लेने के लिए हम एक छोटा सा वीडियो देखते हैं। ऑलराइट, ओके। सो मैं एक बार फिर से आप सब लोगों का आज के वेबिनार योगा फॉर पार्किंसंस के लिए आपका स्वागत करती हूँ। मैं स्वागत करती हूँ डॉक्टर मरिया बरेटो का, जो हमारे सीईओ है। उनका स्वागत करते हुए कि वो कुछ शब्द बोले।
Thank you, Ria. On behalf of Dr. B.S. Singhal and our team, I welcome you to our fourth webinar in our series of webinars as part of our initiative to raise awareness about Parkinson's and to bring to you different ways to effectively manage your symptoms to improve the quality of your life. It is a pleasure for me to introduce Dr. Rajvi Mehta, who is an integral part of PDMDS and has promoted and supported the cause of Parkinson's over the years. Dr. Rajvi and her team at Iyengar Yogashray have been offering Iyengar Yoga to people with Parkinson's for nearly 18 years. Today, she will share her experiences on the effect of Iyengar Yoga for people with Parkinson's, share tips on the practice, and provide some data on the changes that its regular practice brings about, followed by a question and answer session. Thank you, and over to you, Rajvi.
Thank you, Dr. Maria, for the kind introduction. My association with the Parkinson's Disease and Movement Disorder Society, as Maria just said, spans over 18 years. And it's our whole team at Iyengar Yogashray who has been very closely interacting with them. And it is such a pleasure to see the way the society has grown from the time when they had just started with a few centers and the level of work they're doing. Because today in society, the marginalized have really need a lot of support. Now, without much ado, I will go to the topic of today's discussion. I will speak in English or बीच में मैं हिंदी में भी बात करूंगी because I noticed there's a mixed crowd. So specifically, the focus is Iyengar Yoga for patients with Parkinson's disease. Now, सबसे पहले कि हमारी जर्नी पार्किंसन के साथ कब शुरू हुई? We started way back in 2005, 2006, and as Dr. Maria just said, it started with a research study. Now, the story goes that Dr. Maria, who had started this group with Dr. B.S. Singhal, our greatest support for getting into the patient to work with patients with Parkinson's disease, Dr. Maria approached Iyengar Yogashray, stating that if he could help with yoga for these patients, as many of them had shown interest, and yoga was gaining popularity. So we decided that instead of just doing it and making them feel good or not good, let's go and embark on a study. So we did a proper study with a study and control group, and the results were, I would say, gave a lot of confidence to us as much as they gave to the patients. फिर हमने वो presentation international scientific conferences में दिए, और since then we have been regularly conducting a 8-day session at Iyengar Yogashray since 2005, and we must have conducted over 30 such 7 to 8 day workshops. These are classes held 1.5 घंटे का क्लास होता है 7-8 दिन के लिए. शुरुआत में हम लोग 15 दिन का लेते थे. So we have had experience to work with over 900 to 1,000 patients only with Iyengar Yoga. We did a small model of trying this in other cities, 3 to 4 days, where we did simpler things, not what we do at Iyengar Yogashray. So we did this in Pune, Rajkot, Vadodara, Jodhpur, Guwahati, and even in Tel Aviv, Israel. And this work has also been presented in various international forums. And ये patients ने मिलके, they have given a demonstration to public to see that what regular practice of yoga can make them do. So we will share that. And we were very, very fortunate that twice we had Guruji B.K. Iyengar personally coming down to Mumbai and guiding these patients and guiding us on how to work with these patients. So with this little background, with a long association, what I'm going to do is share my experiences on behalf of my entire team. A lot of teachers have contributed to whatever I have said over the years. So now, since there's a mixed group, each Parkinson patient has different symptoms. कोई आता है, general perception of people is कि Parkinson patients have tremors. Tremors is possibly in a very small proportion of patients. सबको tremors नहीं होते हैं. But the most common feature that we have observed in this group from a yoga perspective is the neck stiffness. Their shoulders become very stiff, neck बहुत tight हो जाती है और फिर movements कम हो जाते हैं. Shoulder movements are very, very less. A large number, as the disease progresses, movement becomes difficult and walking becomes difficult. Means they will take a few steps और फिर अटक जाते हैं. और मुझे पता है काफी लोगों को ये प्रॉब्लम होती है and this creates a lot of tension. क्योंकि steps छोटे हो जाते हैं. When you're taking, you can't take big steps, you take small steps. And when you take small steps, suddenly you freeze. And the fear of freezing on the street of Mumbai is quite scary when you're trying to cross a road. As much as everybody does not have the facility to have a car coming to your door, आपको drop करे, आपको public transport भी लेना पड़ता है, आपको चलना पड़ता है. So when you freeze, that is something what we noticed is quite and when you are mentally normal, but because of the disease, there are certain day-to-day activities you cannot do. Shaking while you're walking or freezing, emotions, expressions on the face freeze. Then there is also depression. Confidence gets decreased, and overall, it is also a big strain on the caregiver because caregiver को भी बहुत patience चाहिए. If they don't have the patience, you as a patient feel that you shouldn't overburden, and that's a lot of things. And overall functionality decrease होती है, relaxation. And basically, I'm addressing these issues which we have worked on in our practice with yoga. What all can people do with these to overcome these symptoms? Now, I'm directly going to go to the data from our research studies. So first thing we did was a study over a span of 3 months. 3 महीने तक हमने patients लिए थे, about 30 patients. एक study group था और एक 30 patients जिनको योगा नहीं दिया गया. बाकी सब कुछ same था, दवाइयाँ change नहीं की, all the medications etc. was same. And you can see as the disease was more, the level of intensity was much more. Control group में कुछ ज़्यादा फर्क नहीं हुआ after 3 months. But if you see in the study group, movement improved. So when the movement improved, the scale comes down. There was nearly a 50% improvement in the movement as measured by an occupational therapist. On the other hand, the same assessment was done. जब patient को पूछा गया with a series of questionnaires, 40 question, 39 questions पूछ के assess किया कि how much are they able to move. Again, here there's a very significant improvement in their movement after 3 months. Now, the question is that they have to continue doing. It is not magic. कि कर दिया 3 महीने, you practice for 3 months, then the effect remains forever. No, you have to continue. But I feel that if it makes your quality of life better, why not? Then we looked at the emotions, and you can see because your movement becomes better, stress becomes lesser, confidence improves. In the yoga group also, there was nearly a 30% improvement in the emotions. And even when we assess them in the study group, yoga group, again, when they themselves assess themselves, it was an improvement. Since most of you are patients, I'm sure that you're looking कि आपको हम क्या कर पाए. Results तो है, but हमें क्या मिलेगा उसमें? Because most important is how it helps you. So I'm not going to go more on these data, but directly go to what we do. And to give a little introduction, we are a team of students of Yogacharya BKS Iyengar, and we practice and teach yoga in the tradition of Yogacharya BKS Iyengar, what commonly people across the world called as Iyengar Yoga. And here I would like to quote Guruji, who says, yoga cures what need not be endured and endure what cannot be cured. So we are not claiming that Parkinson's will be cured with the practice of yoga, but surely the quality of life improves if you practice of yoga. We have shown that the functionality, movement improves with the practice of yoga. But you have to practice it. I'm repeating, and I will repeat this again and again. It is not the belief that we do yoga. Now, today, yoga is so popular across the world कि किसी भी बहुत सारी चीज लोग समझते हैं योगा है. or my understanding of yoga, X's understanding of yoga, Y's understanding of yoga may be different. So that is the reason I specify that what we do is Iyengar yoga. Now, in Iyengar yoga, yoga is yoga, but how we differ or what we do different. Now, it is not meant to promote Iyengar yoga, but to give you a clear picture that whatever results I have shown are with the practice of Iyengar yoga. We use props and supports. So, घर में कुर्सी होती है. We use belts, bolster, तकिए, blankets, etc. And we are very, very precise. तो जब हाथ सीधा करना है, तो जिसने क्लास अटेंड किया है, काफी फेसेस है, सीधा मीन सीधा, टेढ़ा नहीं चलता है, and we will guide you how to make it straight. This is to be done only under the guidance of experienced Iyengar yoga teachers. And all the teachers who are directly involved in this study have more than 15 years of teaching experience, more than 25 years of practice. So I want to guide you all that यहाँ पे देख के आप अपने योगा टीचर को कांटेक्ट करके बोल नहीं सकते हैं कि मुझे ये कराओ, because if that teacher does not have the experience, because today people have different experiences with yoga. कोई टीचर एक हफ्ते में सीख के सिखा सकता है, जो अपनी अपनी तरह से सिखाता है, they can teach certain things, but this requires a highly experienced team, a highly experienced teacher to guide you, and subtly, because every patient's symptom is different. Now, X's patient symptoms are different, ability is different, so we need to go. So I'm just guiding you or giving you a background. So please, if you go to a teacher, please go to a recognized Iyengar yoga teacher, which is listed on the website. I will also show you what you can do on your own. So don't be disheartened कि अरे हमें क्लास में जाना है. क्लास में जाओगे तो you'll have more benefits, but surely there is something you can do. So what is this practice that we are talking about? Now, you see when people are walking, the gait freezes very often. So क्या होता है that you people can definitely realize yourself that sometimes when you walk, and especially those who have experienced that their steps become smaller, or you suddenly become very fast. Suddenly आप बहुत जल्दी चलने लगते हो. तो आपको गिरने से बचाने के लिए आप पैर के toes दाबते हो. You press the toes down, and in the process there is a risk of falling down. And everybody fears a fall because most of the time, at least a large proportion of patients with Parkinson's are in the older age group. और अगर fall हो गया तो हड्डी टूट गई तो और tension. So what we make you do is extend the toes of the feet. So I'm going to show here and explain to you what we do so you can use the principles. So आप देख रहे हो यहाँ पे कि मैंने ये just a second, I'll do the pen. So you can see, we make you put some support under the mounds of the toes, ताकि आपके अंगूठे ऊपर जाएंगे और आप दीवार के साथ खड़े रहोगे. आप रोज इसको कर सकते हो थोड़ा सा, और मैं पर्सनली भी अभी आपको दिखाऊंगी कि आप कैसे करोगे. लिफ्ट द टोज अप, एक्सटेंड, पांव का पंजा जो होता है ना उसको फैला के प्रेस इट डाउन एंड देन स्टैंड स्ट्रेट. रोज 4-5 मिनट तो पांव के पंजे खुलेंगे. That is the first. Then gradually we train you to spread your legs. Use the wall. Gradually, as you spread your legs, you get more confidence. You are able to be straight. So the risk of falls and decreases. Then, अभी जब पहले दिखाया तो मैंने क्या बताया कि आपके पाँव के पंजे खोलने हैं. Now sometimes it is not possible to stand also, or sometimes you want to do for long duration. तो आप जमीन पे लेट के you lie down on the floor and same action you try by pressing the mounds of the toes. So you have the अंगूठे, the toes, and उसके नीचे जो होता है वो mounds होते हैं. So precisely the mounds have to be pressed. When the mounds are pressed, the entire leg becomes straight. तो आप यहाँ पे देख सकते हो, you can see how straight this man's legs are. So straightness of the legs also helps you to prevent falls and maintain flexibility in the knee so that you can walk better or prevent issues that come up in future. So this is, and there are many more. I'm showing you very simple things which is possible for you to do on your own. क्योंकि ये वीडियो है ही, और मैंने और एक वीडियो बनाई थी, वो भी आप देख के अपने आप कर सकते हो. So these things, but you have to do it regularly. The more regular you are, the benefits are better. Now, again, straightness on the legs. So we start by helping you to straighten the leg. So the bottom leg is pressed against the wall. नीचे का पाव है वो पूरा दीवार के ऊपर और धीरे धीरे पाव को सीधा करना है. अगर सीधा नहीं होता है तो आप पूरा बेंड करके स्टार्ट कर सकते हो ताकि लेग so that the thigh becomes strong. Remember, Parkinson is a neuromuscular disorder. Must be not be flexible. So don't worry. He will get you to.
Dr. Rajvi,
Yeah,
sorry to interrupt, but I guess there's a
yeah.
network connection issue.
Oh, okay. 1 minute. Let me check. Can you? Yeah. Okay. Okay, I'll be a little loud.
It's okay now. It's okay now.
It's okay. Okay, sorry. Just give me a moment. I'll restart screen share. Is it okay? I'll just screen share screen. So what we do is, 1 second. Yeah, so now I was saying to straighten the legs. Now everybody is not flexible. You may be stiff. So we will gradually get you. So previous slide I showed they were vertical. Now it's okay. So we will support you, but make sure that the knee is straight. We support you and gradually you will be able to go. Nothing comes in a day. Even take a so-called healthy person. First day, they may be, nobody is able to do much. So-called, you can ask your family, your children, whoever is around, they can't do it. But gradually with practice, it improves. So here also with practice, it improves and we get you to do these. So these things are possible. There will be certain guidelines. So of course, it's better with the help of a teacher. Now we can see how to work the neck and shoulders. And here I have specially put this picture of this person, not to demonstrate what is possible, but more so because he was the one who gave us teachers the confidence. Now, Mr. Mascarenhas, and I'm sure Maria remembers him, actually came on a wheelchair. And we are a yoga center, so we are not really running general classes with people with minor therapy issues. Now, we are not geared in that way for severely disabled people or people coming on wheelchairs. Now, what happened was that when he came in, I personally was very scared. I said, we have taken him, but what will we make him do? And believe me, that it is with the full support of his wife, because the caregivers need to bring them. They are willing to do. She brought him every day for the 2 weeks of the session and then once a week for 3 months. And he became straighter. And at the end of the first 15 days, he walked out. And I cannot tell you that it was a big motivator for all of us. And I still remember Dr. Charu Sankla, who came to visit us. And we had a sort of a deal with Dr. Maria that we would teach yoga, you assess them. We will not interfere with the assessment and they should not sort of get in touch with us of what to do or not to do in yoga. And it was a very healthy association. But, you know, when Dr. Charu came to see and these patients were upside down, she was shocked. However, when she saw this gentleman walking by, after that, they said, okay, do what you want with the patients as long as, you know, we were aware. So I tell you that there are some people who have, apart from the PDMDS, Dr. Maria, Dr. Singhal, patients who have given us a lot of encouragement. So this is how we use ropes and belts to get elongation of the neck. So as I started, there's a lot of stiffness hoti hai. Now, mind you, muscles can be relaxed. It's knowing the art, how to do it, and guiding you and persisting. So, usse we managed to get a lot of flexibility in the shoulders of these people and the neck. And you can see, because you know how the gait is, pura shoulder aage chale jata hai. So here you can see how straight they could be. And this, when you walk straight, you are more confident. So this is what we did. Then to get mobility in the spine, and as you can see, we used to take a large group. We still take a large group of people, anywhere between 20 to 35, because we also have a big team of people and enough support. And we get them to do what is twisting asanas. Again, spine has to be straight. So when we say straight, we are like geometry. We help you. बोलने से नहीं होता है. I can't say become straight. अगर होता तो आप करते ही, you would do it. So we help you how to sit straight, how to become tall. When you become tall, you're able to move. And then, but what we learned, first pose Tadasana, open the feet. Then we made people do it lying down. And then we make you, when you're sitting also, spread the foot well. So when the foot is well spread, you are able to sit straight. If your feet are dead, crawling, your spine will go down. Spine will go down, everything collapses. Now, none of you want to collapse. You want to live life. So this is how we help you to do it. Then from there, we do what this is something which we found very effective. It is the supine asana. We use support for the back. Here it is, please do not imitate this on your own. Take the help of a qualified, recognized Iyengar yoga teacher, because if the belt is not placed correctly, it can lead to back pain. But when it is done correctly, it is very effective. So you can see the chest, how well opened it is. Life in the legs, because leg life is important for the movement of an individual. So this is what we did. And then we do relaxations, where we do what is called a Supta Baddha Konasana. Again, the positioning of the belt is important. We also give supports for the thigh depending on stiffness. And here, gradually the breathing becomes softer, quieter, and the individual starts getting more and more relaxed. So there's a combination of elongation of the muscles. There's a combination of bringing the muscle close to the bone. There's a combination of relaxation of the muscles and relaxation of the spine. So it is a very fine art of action and relaxation going simultaneously, so that one can start improving one's function. Then we do what is called a Setu Bandha Sarvangasana. Again, like I said, we use pillows and people are led to relax. So pehle to, if you remember, people are bent forward. थोड़ा आगे झुकते हैं. Then they become straight, and then we are training them to curve backwards a bit. So gradually, you are getting more and more control over the spine and your walking and your shoulders. So you can see the level of opening, and it can be seen in all the people who are around. It's not just with one. Of course, each individual is different. आप देखेंगे यहाँ पे भी कितनी छाती खुल रही है, how much it is opening, and each individual is different. So if you are stiff, then accordingly we will adjust. So that's the responsibility and duty of the teacher, to see how to adjust in your condition. So it's not that everybody can do it, but we try to see that majority of you get the effect. So as I showed in the earlier results of the studies that we did, that majority of the patients find at least a 60 to 70% improvement in movement, provided for that period for which they did. Then this is something which is Sarvangasana, which we found to be most effective. However, as you can see, it requires skill and experience to get the patients to do it. And that comes from the experienced teacher. So you can see a big number of people are doing. And mind you, all these people had Parkinson's disease from 3 years to 10 to 12 years duration. ऐसा नहीं है कि उनको Parkinson's नहीं है और कोई बीमारी है. Most of these had a long duration. Average age is 60, 65 plus. तो ऐसा नहीं है कि young onset वाले, क्योंकि when we started, we didn't see so much of young onset. शायद in a class of 35, one person would be less than 50, or in the 40s. Most were on the older age group. However, pandemic के time पे हमने एक online class लिया था. There were many young onset. So all these are older age group, and we are doing it. But again, it has to be under full guidance till you are trained to do it. So somebody has asked a question also to me earlier, can you demonstrate? I will not demonstrate, because I cannot risk somebody trying to come down and injuring themselves. But it is effective, and it has to be done. So करने से क्या क्या होता है? What all is possible? What all we do now? It depends on the stage of the disease. Now, as I said, it also depends on the motivation of the individual and the caregiver. Because unless the caregiver takes the support, because not everybody is independent to come, you need support. And it is grace of good fortune, or I would request all family members or friends or caregivers that if you can support and get them, we will help you. So, depending on the stage of the disease and the age, although we have found that age doesn't matter, we've got many times people around late 70s and even 80s who are able to do many things. So, age is not really a major criteria. Also, we take into consideration that other health issues. Older people may have hypertension, so we do quite often. So we do take care of that. Experience. I repeat again and again because it's not something that you can request. Okay, I call myself a yoga teacher. Please do it. You need experience, confidence of the patient. Even if you don't have much confidence, it is our duty to build it on you so you can do it. And also, every day is different. Unfortunately, I would say that most of the time, we always do these sessions, except for the few that I said earlier were done in other cities of India. We do that in Mumbai. और unfortunately वो समर में ही हो जाते हैं और आप बोल भी सकते हो कि बॉम्बे में तो हमेशा समर ही है. So we have managed to do this sometimes in the month of April, May, or October, and it is hot. But I really appreciate patients who come and their caregivers because it does make a difference. And then various other factors which we take into consideration. So I would say it is not a list of asanas, what to do, but how to do that is important. Now, again, I would want once again practice whatever you do under the guidance of a qualified teacher. Now, you'll say, where do I find a qualified teacher? You can go to bksangar.com and there's a list of recognized teachers and internationally level 3, level 4 teachers who are the more senior practitioners and teachers would do it. Now, some of you may say, कि आप इतना सब बताते हो, you're telling us that it benefits, and then you say, find a teacher. It's not possible. So what do we do? So don't worry, I will show you what you can do. So ऐसा नहीं है कि मैंने बताया, आपको बताया ये कि this is so nice, so good, so helpful, and then I tell you, you can't do it on your own. तो बोलेंगे आपकी, what is this? If I can't do it on my own, why are you showing it to me? So now I'm going to show you what you can do irrespective of having a teacher or not. Some simple things, if you take care of regularly, then we can guide you on what to do. So I'm going to show you a few tips, some few asana tips which you can do. So first and foremost, I showed you how to stand. So we will be doing, Riya, just tell me in case it's not visible. So you go against a wall, दीवार के पास जाइए, and move your shoulders back. हमेशा पार्किंसंस जिनको होता है ऐसा कंधा होता है. You've noticed it. Shoulder comes forward. There is a lot of space. Shoulder comes forward, neck पे बहुत ही tension हो जाता है. So you will go, roll the shoulders back, ऐसा घुटने मोड़ के, roll shoulders, get the shoulders to touch the wall. You can stand. I will not stand for 2-3 minutes, but I will show you. So bend your knees, rest the shoulders, and come up. Then you can take something like a blanket, mat, tightly roll kar dijiye. Roll it tightly, place it on the floor, and as I explained earlier, these are the toes, these are the mouse. Mouse को उसके ऊपर रखना है. Press the mouse, lift the toes up, roll the shoulders back. This everybody can do. If you have no balance, spread the feet, press the mouse and stand. If there are tremors, press the palms against the wall, but shoulders have to go back. After that, इतना action आ गया, आप हाथ को interlock करोगे, take them over the head. Now see, elbows will come forward because आपके shoulders आगे जाते हैं. So interlock the fingers, flatten the palms, move the elbows back. इतना कीजिए. Elbows आगे हैं, elbows को पीछे कीजिए. Let it touch the wall. Afterwards, slowly straighten the arms. I repeat, हाथ के पंजे को flat करो, एल्बोज को पीछे लो एंड देन स्लोली स्ट्रेटन। अभी इसमें क्या होगा कि पार्किंसन की इफेक्ट बहुत लोगों को एक ही साइड पे होती है। तो क्या होगा कि एक हाथ सीधा होगा और दूसरा बेंड रहता है। उसके लिए आपको फर्स्ट इज द बेंड साइड जो होती है ना, उसको 2 बार करना पड़ेगा। तो उसको थोड़ा ज्यादा ट्यूशन चाहिए। तो उसको पहले से आप उसको पीछे लेके फिर धीरे धीरे सीधा करो। समटाइम्स हाथ भी नहीं जोड़ सकते हैं यार, यू कैन जस्ट अनम्यूट इफ यू आर पासिंग अ मैसेज। सो कभी कभी आपका हाथ भी सीधा नहीं होता है। तो व्हाट यू कैन डू इज, हाथ का पंजा है, दूसरा हाथ पीछे, उसको आगे से अपने फिंगर्स को पकड़ के, सो सी हाउ यू विल डू, बिकॉज समटाइम्स यू कांट स्ट्रेटन ऑल्सो। नाउ टेक वन हैंड, अदर हैंड फिंगर्स इन द फ्रंट, पीछे का हाथ ऐसे दबाना है, देखा? तो आगे यू आर टर्निंग लिटिल फिंगर साइड, बैक थंब पुश इट, देन you will stand or you can sit and you will straighten the arms. तो हाथ सीधा होगा, हाथ का पंजा को पूरा टर्न करना है। तो वापस से देख लीजिए, बिकॉज दीज आर थिंग्स आप अपने आप भी कर सकते हो, उसमें कोई डर नहीं है और कर सकते हो। तो पंजा लेके फिंगर्स ऑफ द अदर हैंड प्रेसिंग द माउंट, थंब pressing the wrist and take it up. So this is how you will straighten. No tension in the neck. Neck soft. Then repeat it on the other side. Press the fingers on the palm. Angutha, thumb on the other side and extend. So this is preparation. You can do it standing. You can sit on a chair. जमीन पे बैठने की जरूरत नहीं है. If you cannot, I'm just showing it. And then interlock and extend the arms up. So this you will give a lot of flexibility and movement in the shoulder and the neck. Then other thing that you can do, which you will do only sitting, you can sit on a chair and do, extend the arm forward. तो हाथ है पूरा सीधा, ये दिखाया अंगूठा नीचे की तरफ, turn the fingers down. So this is the thumb, turn the thumb side down, support the arm at the elbow. Elbow के ऊपर थोड़ा support करके extend the arm. ठीक है? ऐसा हाथ मरा हुआ नहीं उठाना है. Support, strongly support, extend the arm and bend the arm at the elbow. देखा? So side से देखिए, extend, turn the thumb out, support the arm at the upper arm दूसरे हाथ से. तो आपको किसी की जरूरत नहीं है, आप खुद कर सकते हो. You don't need anybody's help. Turn, keep turning the arm in, take the hand up and take the hand down. Now you will be stiff. मैं मानती हूं कि आप लोग स्टिफ होंगे. You will be stiff. Your elbow may come forward. Don't push it back. उसको पीछे नहीं करना है. आपको क्या करना है? What you have to do is pull the skin up. Hand will go back. I show again in the front. Your hand will be stiff. Elbow will come forward. Don't push it. By this you will injure. Just lightly put your other hand like a cap, like a topi. Put it and just pull the skin. Hand will go back. This is how you will get some movement. So this is Gomukhasan arm action. It has to be done on both sides. Support, turn and move. So one side may be difficult, one side may be easy. Then you all would have chairs at home. कुर्सी तो होगी ही. So you can sit. So जो भी कुर्सी है, मेरी कुर्सी जो है वो योगा चेयर है, but you can use your dining table chair as long as it is sturdy. हल्की कुर्सी मत लेना, एक not plastic chair but strong chair. Sit straight. क्या सिखाया था? Become tall. Press the feet down. Hold the chair. Become tall and turn. श्वास छोड़ के टर्न करना है, लंबा होके. तो आप आगे से भी देख सकते हो. What do I do? ये तो खाली पैडिंग के लिए रखा है. You sit sideways. अच्छी तरह से बैठना है. Become tall. लंबा हो जाइए कुर्सी को पकड़ के. और लंबा होना है and then turn. थोड़ी सेकंड रहना है. Do not hold your breath. श्वास को रोकना नहीं है. Exhale, turn. दोनों साइड करना है. सो एक बार और दूसरी बार. Again, tall, turn. ठीक है. और भी मूवमेंट्स है, लेकिन मैं लिमिटेड दिखा रही हूं जो आप अपने आप कर पाएंगे. फिर आई शोड सेतुबंध सर्वांगासन. तो घर पे आपके तकिए होंगे. ठीक है. और आप फर्स्ट आई शो यू बद्धकोणासन. घर पे तकिए हैं. तकिए को नीचे रखो. आप पलंग पे भी कर सकते हो. यू कैन डू इट ऑन द बेड ऑल्सो. सो इफ यू कांट सिट ऑन द फ्लोर, do on the bed. Simple, spread the feet, move away and rest. Now, some of you, क्योंकि शुरुआत में back is like this, you may not be able to rest. So take a blanket, pillow and support the head. So lie down and roll the blanket, support the head and stay. Now some of you may find कि यहाँ पे दर्द होता है, यहाँ टाइट है. You can take a book, a block, or even a dabba, a small box, anything which can support 2-3 pillows. Place it by the side. So just a little support and your pain will go. Lie back, support the head, and just lie down. You can do it on the bed. Stay easily. You can stay for 5 to 10 minutes. That will help you rest. To come up, bring the knees closer, turn to the side, and then sit up. And then the last asana that I will show you is Setubandha Sarvangasana. Again, you can do it on a hard bed because I know some of you may be scared कि नीचे बैठेंगे, खड़े नहीं हो पाएंगे. If I sit down, so you will sit on this bolster, loosen the t-shirt so you don't get choked. Now make your back, see how I'm doing. Your hand will be there, lie back. And then slowly press the feet and slide down. So shoulders rest. Agar aap stiff ho, I'll show you once again. So you will loosen the t-shirt, go close to the wall. देखिए bolster और wall के बीच में जगह है. Then lie back. Slowly, as if you're sleeping on that pillow, and push yourself so shoulders come down. Even this, you can be for 5 minutes. Head should not be hanging. So अगर आप stiff हो, तो आप थोड़ा और support ले सकते हो. And after that, you will turn to the side, and this is it. So I have shown you few asanas. I've shown you Tadasana, Urdhva Badungli Asana, Urdhva Hastasana with the hand, Gomukhasana arm action, Bharadwajasana, Baddhakonasana, and Setubandha Sarvangasana. There are many more asanas that can be done, but like I said, safety is first, so this is the minimum. Now, I would like to show you a video which has been done by patients themselves. So these are patients with Parkinson's. Some of them, this was done at one of the World Parkinson's Day demonstrations in Mumbai. And many of these patients were already patients of Parkinson's for 10 years or more. So I'm just going to share that video with you. And it's a 6-minute video, but the idea is to motivate you, whatever condition, you can do it. Okay.
Away, then yoga to invoke this theme. Yoga, which is derived from a Sanskrit word meaning union, is one which unites the body, mind, and soul. Our patient members from the Iyengar Yogashraya bring to you a yoga performance invoking the blessings of Lord Patanjali to give strength to all our performers here today.
this was just a demonstration, mind you. If you are interested and you have support for somebody to bring you to a call, if we will help you out. This was primarily to motivate you. There were people here who had already diagnosed with Parkinson's for 10 years. And then they did this. This video was done in 2016. And many of these are still with us, practicing regularly, traveling on their own. So basically, for 15, 18 years, they are independently traveling to come to the class. So the final thing before I take the questions is people may want to know what to do next, because I hope that yes, and with the excellent support that the Parkinson Society is giving. So I'm just going to say that we are planning a session at Iyengar Yogashray, Lower Parel in Mumbai, April 24th to April 30th. You can contact our admin Rohini if you are interested या किसी को करना है. So purposely we have given 1 month time. If you need to arrange for organizing people to get you, and we keep it in the afternoons to prevent you from getting stuck in traffic and the practical limitations of Mumbai. And with this, I end my presentation. I hope it has given you confidence to live with this disease, and it's a support that we are giving in addition to all the other support that PDMDS is giving all of you to live a full life. So thank you so much, Maria. Thank you, team. And I would like to thank my entire team of teachers at Iyengar Yogashray. This is all of them that have supported, and the patient's confidence. And finally, to Guruji, who has gave us the confidence to take up this project and sharing his knowledge with us over the decades. So thank you, everybody. And now I'm open to any questions or anything that you may have. Ria, you can throw the questions in.
Yes. So thank you, Dr. Rajvi. It was very informative and your demonstration did help us a lot. So we are now open to taking questions. तो जिनको भी कुछ क्वेश्चन पूछने हैं डॉक्टर राजवी को जो योगा रिलेटेड है वो अपने चैट बॉक्स में आप टाइप कर सकते हैं वेदर यू आर ऑन जूम या यूट्यूब इट्स ओके यू कैन जस्ट टाइप इन द चैट बॉक्स वी विल टेक 5 to 6 questions.
Yeah, you can read out any. I see by Loha. Loha, you can get in touch with me directly and I will guide you. So for teachers of Iyengar Yoga who need any specific guidance, qualified teachers, you can directly get in touch with me and we can work out something. Is it possible for a teacher to come home? As of now, unfortunately, we do not have teachers who can come home. But what you can do is you can check this particular, and I have also another YouTube video, which is there on the PDMDS YouTube channel, which we did during the pandemic. उसमें detailed instructions है. आप उसको follow कर सकते हो easily, जैसे मैंने बताया है. And then if you have any queries after that, you can get in touch with me either directly or through PDMDS. So we can possibly see how we can specifically help you. But if you can make it for a week, it will be helpful because then we can personally see your condition and guide you. Any more questions?
Someone is asking what can we do for balance issues. I guess Dr. Rajvi has already addressed that in her PPT and in her demonstrations. So
the point is कि जब बैलेंस का प्रॉब्लम होता है ना, क्योंकि पांव ठीक से नहीं चलते हैं. सो जो मैंने दिखाया सीधा करना है, ताड़ासन में सीधा खड़े रहो विद द बैक टू द वॉल, जमीन के दीवार को पांव एक्सटेंड करो, जो कैसे आपको बेल्ट लेके हमने पीछे सीधा करवाया, तो ऑटोमेटिकली बैलेंस आ जाएगा. फिर धीरे धीरे चलने में सिखाएंगे हाउ टू मूव सो दैट योर बैलेंस इश्यूज बिकम लेस. तो जो सब वीडियो में दिखाया, all of them will help with balance. Is there any teacher in Singapore? Yes, you can go to the website. We have teachers. Jaipur, unfortunately, we don't have any teacher in Jaipur or anywhere in Rajasthan. But if you can make it for a week with somebody, we will teach you how to do it on your own. And then limited, but आप अभी इतने सालों में हम भी कैसे सिखाना सीख गए हैं थैंक्स टू PDMDS. तो हम आपके घर वालों को है आपको सिखाएंगे. जैसे आपने डेमोन्स्ट्रेशन की वीडियो में देखा, people were doing it independently. Obviously they were not able to do it independently. या पहली बार तो मोटिवेट बहुत करना पड़ा है सर्वांगासन कैसे करना है, बट ओवर अ पीरियड ऑफ टाइम वो सीख गए, आपको भी सिखा सकते हैं प्रोवाइडेड आप मूवमेंट है आप में, तो हम आप यहाँ पे आ जाएंगे. Any fees? Yes. I have a problem from the chair or I fall back. Okay, that one will have to look at it, whether it is PD or it is something else, supranuclear PSP. So maybe that the doctor can guide you and we can see what can we do. Because from my experience, generally Parkinson's patients fall forward. Correct me if I'm wrong, Dr. Maria Ria. So that may be a PSP case. Any fees? Well, ours is a trust. The charges for these sessions are, I think, Rohini, you may correct me, something like 1,500 for the whole week or 7 days. However, if there is somebody who cannot afford that, we can give a discount. So that money is not the criteria. We will have to look at it, Smriti Rekha, imbalance and vertigo, because all of these are interrelated. Stiffness of the neck causes blocking of the ears, and especially if the head goes back, you start feeling dizzy. So this may be interlap, maybe there's shortening of the neck, and we'll have to sort of look into it. But personally, देखना पड़ेगा. Can a MSA patient do it? What is MSA? Ria, there's some question from.
Dr. Rajvi, we have some questions on YouTube. How
Okay.
long should you practice yoga every day?
So our sessions are about 1.5 hours, but considering that, we are giving a lot of instructions and guidance, actual practice may be 45 minutes, but it is what you practice, not just practicing for 45 minutes. It's what you practice. Initially, I would say after we have trained, you can do it 2 to 3 times a week only. Then we will see how to add more.
Someone is asking if they have fractured their femur and have an implant, can they yet go for yoga sessions?
Yes, if they are mobile, yes.
Okay. Somebody has a problem in seating on bed and cannot balance, and they fall behind, and I'm not getting to cross their body in the bed. So can you guide them about some
So
tips
I
that they
will
can
need
follow?
to. I cannot. This is a little tricky because it's not one of the usual common as far as I've seen. So we will need to see the person.
All right. And can you guide about stiffness in the neck? Some
All that I did, काफी मैंने जो दिखाया, it all works with the stiff neck. But mind you, एक आसन से नहीं होता. It's a proper series of things that we do. एक चीज से कुछ नहीं होता है. वो पूरा सीरीज करना पड़ता है और एक दिन में कुछ नहीं होता है. I can tell you that people who have done it regularly, they have had ups and downs. क्योंकि age तो है आपके, everyone, even me and Ria are also growing older every day. So age तो है ही आपके साथ. तो despite that, they come back, but continue करना पड़ता है. So कैसे करना है उसके ऊपर है.
And one last question, Dr. Rajvi, is there any yoga asanas or any yoga tips that people can follow for speech?
Actually, you know what? All this also releases the throat and works it. But what I have found which I've learned from one of our patients only, is she does a lot of chanting. And that has helped with the speech in addition to what she's doing in class. So Sarvangasana, Vipridandasana, with the curved back, etc. But again, if you have not done it, don't try it on your own. But along with that, with chanting, she has found a lot of improvement because earlier I couldn't follow what she was saying. That was about a year ago. And now, it's much better. So that can be an add-on tip beyond yoga.
So, thank you, Dr. Rajvi. Thanks a lot. It has really been helpful, and I hope that we will all try to inculcate some part of yoga into our daily life.
So I'll just share because some people have asked for contact. So the
Yeah, so on behalf of all of us, Dr. Rajvi, thank you so much. You know, we have a huge number of new people and new members who were possibly not part of the program that we did earlier, the program that we've been doing through the years. So I think this would be important that they also understand, and I'm really grateful for your support and your offering to do a program for us again. So thank you once again.
Thank you. Thank you, Maria. Thank you, Ria. And thanks to all of you for your patience and wish you all the best. Okay. Can we leave, Ria? Or any more questions coming?
Yes.
Okay.
So, thank you
Yeah.
everyone for joining us. It was wonderful to have you all over here. It was nice, very good questions, good demonstrations, and information by Dr. Rajvi. I hope you all enjoy.